1. A patient reports chronic neuropathic pain unrelieved by current medication. Which action best demonstrates patient-centered communication? A. Tell the patient to continue current therapy. B. Refer directly to psychiatry. C. Explore pain history and preferences for alternative therapies. D. Explain that neuropathic pain is usually untreatable. 2. A new nurse on the unit struggles to assess pain in nonverbal patients. What mentoring strategy aligns with adult learning principles? A. Assign a textbook chapter on pain scales. B. Role-play pain assessment using case scenarios. C. Instruct the nurse to observe senior nurses silently. D. Require weekly quizzes on pain terminology. 3. A nurse educator is revising the pain management module. Which curriculum development principle ensures quality education? A. Base content on anecdotal experience. B. Use out-of-date institutional policies. C. Align learning objectives with current evidence-based guidelines. D. Focus on memorization of drug names. 4. A patient recovering from abdominal surgery rates pain as 8-10 despite medication. What is the nurse's priority action? A. Tell the patient to wait for the next dose. B. Notify the provider for potential order changes. C. Document the complaint and continue care. D. Suggest using ice packs without assessment. 5. A nurse is mentoring a colleague who underutilizes non-pharmacologic interventions. Which approach promotes skill development? A. Assign passive learning modules. B. Ignore the issue unless a complaint arises. C. Demonstrate techniques and guide reflective practice. D. Ask the colleague to read policy manuals. 6. Which tool best evaluates the effectiveness of a hospital's pain management education session? A. Participant attendance record. B. Self-reported satisfaction surveys. C. Pre-post knowledge assessments with case studies. D. Number of handouts distributed. 7. A patient with cancer reports increased pain at night. What nurse-led intervention best supports symptom management? A. Reassure the patient and delay action. B. Adjust the timing of medication with provider input. C. Withhold medication until morning. D. Ask the patient to rate pain only once daily. 8. What is the most effective mentoring technique to improve pain documentation accuracy? A. Audit notes weekly without feedback. B. Provide corrective feedback immediately post-assessment. C. Assign online documentation tutorials. D. Expect improvement without structured support. 9. A nurse is educating a patient on opioid use. Which adult learning strategy enhances patient understanding? A. Use complex medical language to ensure detail. B. Deliver a lecture-style presentation. C. Encourage questions and use teach-back methods. D. Provide pamphlets only. 10. Which symptom requires immediate reassessment of a patient's pain management plan? A. Mild dizziness. B. Anxiety before discharge. C. Agitation and grimacing at rest. D. Slight temperature elevation. 11. A nurse is developing content for a workshop on chronic pain. What should guide topic selection? A. Length of presentation. B. Popularity of topics in past sessions. C. Current patient population needs and clinical evidence. D. Presenter comfort level. 12. What evaluation method best determines whether nurses are applying pain management techniques effectively? A. Multiple choice quiz. B. Simulation with feedback and direct observation. C. Monthly meeting attendance. D. Policy review acknowledgement form. 13. A preceptor wants to improve a novice nurse's assessment of breakthrough pain. What is the most effective method? A. Provide policy copies. B. Assign unrelated readings. C. Use bedside coaching and real-time discussion. D. Remove the nurse from high-acuity assignments. 14. A patient with dementia shows behavioral changes. What is the best nursing response? A. Increase stimulation to distract from behavior. B. Assume changes are unrelated to pain. C. Assess for pain using observational tools. D. Call family to manage symptoms. 15. A nurse educator receives feedback that a symptom management course lacked clarity. What should be the next step? A. Ignore feedback due to time constraints. B. Review learner evaluations and revise content objectives. C. Reduce course time for future sessions. D. Focus on increasing visual aids only. 16. Which regulatory guideline should be followed in opioid administration? A. Patient's preference alone. B. Joint Commission pain management standards. C. Manufacturer marketing literature. D. Personal clinical opinion. 17. A nurse notices delayed pain reassessment after interventions. What leadership response ensures regulatory compliance? A. Increase patient loads to promote urgency. B. Emphasize documentation timing in performance reviews. C. Provide unit-wide training on timely reassessment. D. Change documentation system without training. 18. A patient on PCA pump reports no pain relief. What is the nurse's immediate action? A. Increase dosage manually. B. Disable the PCA device. C. Assess pump function and report to provider. D. Tell the patient to wait 2 more hours. 19. How can a mentor best support critical thinking in pain medication titration? A. Provide fixed schedules. B. Discuss patient scenarios and titration rationale. C. Delegate titration to pharmacists only. D. Focus solely on adverse effects. 20. A nurse educator wants to assess long-term retention of pain management skills. What method is most appropriate? A. Weekly written quizzes. B. 6-month follow-up simulations with evaluation. C. Satisfaction survey post-course. D. Verbal feedback at the end of the training. 21. What behavior reflects poor symptom management documentation? A. Timely entries with pain scale usage. B. Generalized phrases like patient comfortable. C. Clear records of interventions and outcomes. D. Reassessment timestamps. 22. A nurse repeatedly omits non-pharmacologic strategies in care. What mentoring technique promotes accountability? A. Avoid follow-up to prevent discomfort. B. Assign readings without evaluation. C. Schedule reflective supervision and action planning. D. Expect peer correction. 23. A patient complains of severe nausea after opioid administration. What is the nurse's first priority? A. Discontinue medication without consulting provider. B. Administer food to reduce symptoms. C. Assess nausea severity and notify provider. D. Tell the patient it is a normal side effect. 24. What best promotes consistency in hospital-wide symptom management? A. Annual memos. B. Standardized protocols and periodic audits. C. Verbal reminders. D. Independent nurse interpretation. 25. A patient with a history of addiction requires pain control. What approach ensures ethical and effective management? A. Withhold opioids entirely. B. Focus on past history only. C. Use multimodal strategies and monitor closely. D. Let the patient choose medications freely. 26. A nurse leader observes inconsistent pain reassessments. What is the most effective system-level intervention? A. Increase charting requirements. B. Provide individualized feedback in team training. C. Limit reassessments to once per shift. D. Focus only on surgical units. 27. A mentor is coaching a nurse through assessing complex pain in end-of-life care. What strategy is most appropriate? A. Assign independent study modules. B. Demonstrate and co-assess patients with guided reflection. C. Limit nurses' access to high-needs patients. D. Delay intervention until formal training. 28. How can nurse educators ensure that symptom management content reflects current best practices? A. Refer to peer-reviewed literature and clinical guidelines. B. Use last year's content without revision. C. Prioritize convenience over accuracy. D. Avoid controversial updates. 29. What evaluation method most accurately measures behavioral signs of pain? A. Self-reported scales only. B. Behavioral observation tools with inter-rater reliability. C. Staff discussions. D. Shift reports. 30. What is the most effective way to address cultural barriers in pain assessment? A. Avoid discussing culture. B. Use culturally validated pain assessment tools and open dialogue. C. Standardize a single pain scale for all patients. D. Ask family to interpret symptoms. 31. A nurse fails to document breakthrough pain. What regulatory risk does this pose? A. None, if patient is stable. B. Increased liability and compliance violation. C. Reduced satisfaction scores only. D. Delayed pharmacy delivery. 32. What is the best mentoring approach to develop new nurses' confidence in symptom management? A. Assign repetitive tasks. B. Offer consistent feedback and clinical reasoning support. C. Delay complex cases. D. Ignore mistakes to foster independence. 33. A patient with renal failure is prescribed morphine. What is the nurse's priority? A. Administer the dose immediately. B. Review medication appropriateness and report concerns. C. Trust pharmacy dosing blindly. D. Instruct patient to hydrate. 34. A nurse's pain assessment notes are incomplete. What evaluation tool should a nurse manager use? A. Staff satisfaction survey. B. Documentation audit with a standardized checklist. C. Informal staff polls. D. Weekly huddle feedback. 35. A nurse educator prepares a module on pain in older adults. What content is essential? A. Age-specific pharmacodynamics. B. Use of pediatric scales. C. Emphasis on subjective data only. D. Elimination of case studies. 36. How should a nurse document a patient's verbal pain report? A. Patient seems fine. B. No visible distress. C. Patient states pain is 7 out of 10 in lower abdomen. D. Pain not observed. 37. A nurse manager wants to measure staff improvement post-symptom training. What tool is best? A. Pre-post simulation evaluations with scoring rubrics. B. Attendance log. C. Printed certificates. D. Unstructured observation. 38. A nurse reports no time for proper pain reassessment. What leadership response is most effective? A. Ignore to avoid pressure. B. Delegate reassessment to aides. C. Reevaluate workload and reinforce priorities through coaching. D. Remove the nurse from care assignments. 39. How should a nurse respond to a patient requesting early PRN pain medication? A. Administer without review. B. Deny request without discussion. C. Assess pain, review timing, and notify provider if needed. D. Refer to pain management later. 40. Which communication strategy enhances interprofessional pain management? A. Delay updates to avoid interruptions. B. Use standardized handoff tools like SBAR. C. Focus only on written notes. D. Limit updates to urgent cases. 41. A patient with COPD experiences shortness of breath and anxiety. What is the most appropriate nursing intervention? A. Administer opioid without assessment. B. Elevate the head of bed and implement calming techniques. C. Tell the patient to wait until the next dose. D. Ignore symptoms as psychosomatic. 42. What method best ensures that nursing staff retain symptom management knowledge over time? A. One-time workshop. B. Annual self-paced modules. C. Regular simulation refreshers with case debriefs. D. Monthly policy review emails. 43. How should a nurse respond to a family requesting more pain medication for a sedated patient? A. Increase dose independently. B. Reassure them and do nothing. C. Reassess pain using clinical tools and collaborate with provider. D. Instruct them to be patient. 44. A nurse uses a numeric pain scale incorrectly. What is the most effective mentoring response? A. Send an email reminder. B. Publicly correct the mistake. C. Demonstrate proper usage and review scoring with feedback. D. Ignore it unless it repeats. 45. A nurse is assigned to teach pain assessment to new hires. What educational strategy ensures engagement? A. Read policy verbatim. B. Assign individual readings only. C. Use patient scenarios and interactive group activities. D. Deliver a 2-hour lecture. 46. What is the best way to address underreporting of pain in patients from certain cultural backgrounds? A. Avoid asking to prevent offense. B. Assume pain if nonverbal cues appear. C. Ask open-ended questions and validate experiences. D. Use the same tool for all regardless of background. 47. A mentor wants to build trust when teaching symptom management. What principle supports adult learning? A. Passive instruction. B. Prescriptive direction with no feedback. C. Mutual goal setting and two-way feedback. D. Assigning memorization tasks. 48. A patient with liver disease requires acetaminophen. What is the nurse's responsibility? A. Administer full dose as ordered. B. Check for contraindications and notify provider. C. Give medication with food. D. Replace with ibuprofen without consultation. 49. A nurse is resistant to using non-pharmacologic interventions. What strategy best facilitates behavior change? A. Assign more reading. B. Emphasize policy compliance without context. C. Model the interventions and explain patient outcomes. D. Threaten performance review. 50. A nurse frequently delays PRN administration. What is the appropriate managerial action? A. Observe and provide real-time coaching. B. Reassign to administrative duties. C. Issue immediate reprimand. D. Reduce patient load permanently. 51. A patient receiving chemotherapy reports neuropathy. What should the nurse do first? A. Instruct to wait and monitor. B. Reassess symptoms and coordinate with the care team. C. Ignore if vitals are stable. D. Offer unrelated distraction. 52. How can nursing leaders reinforce safe opioid administration practices? A. Encourage peer feedback and use of double-check systems. B. Reduce opioid use to zero. C. Discourage discussions to avoid alarm. D. Rely solely on physician guidance. 53. A patient receiving pain meds develops respiratory depression. What's the nurse's priority? A. Monitor hourly. B. Notify provider and follow emergency protocol. C. Wait for spontaneous resolution. D. Document and continue. 54. How can a nurse ensure accuracy when documenting pain reassessments? A. Use estimated times. B. Complete notes after shift. C. Document immediately post-intervention. D. Leave for charge nurse. 55. What teaching method is best for educating patients with low health literacy about pain meds? A. Complex medical brochures. B. Lecture with medical terms. C. Visual aids and teach-back strategy. D. Written instructions only. 56. A patient reports uncontrolled pain after discharge. What system-level solution can address this? A. Standardized discharge pain education protocols. B. Avoid follow-up unless patient returns. C. Defer to primary care provider without review. D. Reassign education to pharmacy. 57. A mentor wants to promote critical thinking during a pain management case discussion. What is the best question type? A. Yes, no questions. B. Open-ended clinical scenario questions. C. Definitions only. D. Personal opinion prompts. 58. A nurse reports difficulty prioritizing symptom management in a busy unit. What support strategy helps most? A. Decrease patient assignment. B. Provide time management training linked to pain management priorities. C. Instruct to handle all tasks first. D. Delay symptom care to end of shift. 59. What is the nurse's role in educating patients about potential side effects of pain medications? A. Omit side effects to avoid fear. B. Provide comprehensive, understandable information. C. Only discuss if asked. D. Rely on pharmacist exclusively. 60. A patient reports spiritual distress contributing to physical pain. What is the appropriate nursing intervention? A. Disregard as irrelevant. B. Refer to chaplain and integrate holistic care. C. Focus only on medication. D. Delay until team rounds. 61. Which approach best ensures compliance with regulatory guidelines and pain assessment? A. Annual reminder emails. B. Regular audits and staff retraining. C. Informal peer discussions. D. Verbal reports only. 62. A patient with fibromyalgia expresses frustration with ongoing symptoms. How should the nurse respond? A. Suggest stronger medications. B. Dismiss concerns as psychological. C. Validate feelings and explore symptom management options. D. Encourage ignoring symptoms. 63. A nurse educator introduces a simulation on symptom escalation. What evaluation method ensures learning occurred? A. Debrief and structured simulation rubric. B. Group survey only. C. Observation without scoring. D. Role play without feedback. 64. How should nurses approach patients reluctant to report pain? A. Accept silence as absence of pain. B. Reassure them reporting won't affect care. C. Wait until they volunteer information. D. Document no pain without inquiry. 65. A new nurse is unsure when to reassess pain post-intervention. What teaching method is most effective? A. Timetable chart and real-time mentoring. B. Independent reading. C. Quiz on policy. D. Ignore until mistake occurs. 66. What is the most critical aspect of mentoring in symptom management? A. Assigning modules only. B. Creating safe space for reflection and skill development. C. Public correction. D. Task delegation. 67. A nurse fails to report new symptoms in a post-op patient. What leadership response promotes safety? A. Immediate punitive action. B. Educate using a root cause analysis discussion. C. Dismiss due to minor issue. D. Reassign without explanation. 68. Which data best supports evaluation of pain management interventions across a unit? A. Medication expense report. B. Patient-reported pain scores and reassessment compliance rates. C. Nurse vacation schedules. D. Number of staff per shift. 69. A patient refuses opioids. What is the nurse's next best step? A. Cancel all pain orders. B. Explore reasoning and offer alternatives. C. Ignore refusal. D. Report noncompliance. 70. How can nurse educators promote active learning in symptom management training? A. Assign policy readings. B. Use interactive scenarios and team challenges. C. Deliver slides with limited engagement. D. Limit training to lecture. CMSRN pain and symptom management. The CMSRN pain and symptom management test is a rigorous, domain-specific examination that evaluates a medical surgical nurse's ability to assess, manage, and educate patients experiencing acute and chronic pain, as well as a wide range of physical symptoms. The test emphasizes evidence-based practices, interdisciplinary collaboration, regulatory compliance, and patient-centered communication to ensure quality care delivery. It also measures the nurse's ability to apply adult learning principles in patient and family education, evaluate treatment outcomes, and mentor peers in symptom management strategies. Designed for high-stakes clinical environments, the exam ensures nurses are competent in developing individualized care plans, advocating for effective pain control, and enhancing patient comfort and safety across diverse populations. Here are the top 5 beneficial uses of the sample exam. 1. Enhances clinical competency. the test ensures nurses are proficient in evidence-based pain and symptom assessment, pharmacologic and non-pharmacologic interventions, and patient-centered care strategies. 2. Improves patient outcomes. By validating a nurse's ability to manage pain and symptoms effectively, the test supports reduced complications, increased patient satisfaction, and faster recovery times. 3. Supports professional development. Achieving certification demonstrates a commitment to excellence and continued learning, opening pathways to leadership, advanced roles, and recognition in medical surgical nursing. 4. Strengthens compliance and safety. The test reinforces knowledge of regulatory standards, ethical practices, and safe medication administration, reducing risk and liability in clinical settings. 5. Promotes mentorship and education. Certified nurses are equipped to mentor colleagues, educate patients and families on symptom management, and contribute to curriculum and protocol development.